Well, good evening, everyone. Thank you so much for joining us here at Next Haven in the Dixwell neighborhood of New Haven. I'm Lucy Nalpathanchil with Connecticut Public, and it's our pleasure to partner with Connecticut Black and Brown Student Union on this series called Serving the Whole Child. And we really appreciate your interest tonight to hear these different perspectives, including the perspectives of young people. As I mentioned, I'm with Connecticut Public, so for those of you who are not familiar with us, we're the statewide NPR and PBS company in Connecticut. And we decided to focus on this series in partnership with the Connecticut Black and Brown Student Union because I think everyone in the room can agree that a child's ability to be successful has repercussions for them, their family, and their communities. But we also know that there are many factors that impact a child's trajectory. And so this series focuses the conversation on some social determinants that impact a child's success. So tonight we're going to talk about what communities and policymakers can do to help address these challenges. I wanted to introduce our panelists first, and after we talk for about 40 minutes or so, we will open up the conversation to you in the audience if you have a question or comment for our panelists. So I'll begin by introducing our fabulous panelists here tonight. First up is Organizing Director of Connecticut Black and Brown Student Union, Fareus. Shine is an anti-racist educator, community organizer, and a transformative leader from New London. Now, when I first met Shine, one of the things that stood out to me, besides her smile, was the fact that she was pushing for access to equitable education when she was just a public school student. When she was in high school, she was co-founder of Hearing Youth Voices. Shine, I'm so glad to have you on the panel tonight. Don't forget to put the mic close to you.
Hello, everyone. Hi, thank you so much for coming. It's such a pleasure to have the community come and be a part of these conversations. And I want to say tonight you might just be here for a conversation. I know each and every single one of you are here because you're interested in your day-to-day life, your 9 to 5. You're doing other things in the community that is impacting the way in which we continue to have these conversations. So thank you so much for being here. I'm excited for the conversations we're going to be having. So tonight, it's just a conversation, right? You all are used to these conversations, and there is so much to be said that we can't say in 40 minutes. But this is a continuous series that the conversation continue outside of this room and in the work when you leave this room and the people you're interacting with and connecting with on a day-to-day basis.
Thank you, Shine. I also want to thank the Graustein Memorial Fund for their support for this series. We appreciate that as well. Sitting next to Shine is Daniel Palma, who's a high school senior at East Haven High School. And member of Health Occupation Students of America, also a member of Connecticut Students for a Dream. Now, Daniel told me that he didn't know what fulfilled his life until he discovered advocating. Daniel also likes to hike. And one more fun fact, he does not drink any coffee or soda. That's a healthy choice from someone who drinks too much coffee. And Daniel, it's such a pleasure to have you here on the panel. Thank you for being here tonight.
I want to thank you for considering me to invite me to here and to have such an interesting public in here that needs to know what we're talking about. Thank you.
Thank you, Daniel. Next to Daniel is Janaai John, also a senior at New Britain High School and member of Connecticut Students for a Dream. This is what she shared with me. As a first-generation Black immigrant, she says joining Connecticut Students for a Dream has made her feel like there's finally an outlet for her. Janaai is also a student at Greater Hartford Arts Academy half-day program where she studies acting. She was the former president of the NAACP New Britain Youth Council, and she's interested in pursuing modeling, acting, and entrepreneurship as a career. Her interests have led her to host fashion workshops as a way to spread a positive influence within the community. In fact, she's hosting a workshop this Friday, I believe. Janaai is busy. Thank you, Janaai, for being here tonight.
Thank you so much for having me. I am so glad to just speak my truth about what I think about, this topic, advocating for health insurance and being a Black immigrant. No one really talks about that. No one really thinks about that, right? So I'm just really glad to share like what I think with you guys. Thank you so much for having me.
Thank you, Janaai. And Rosana Ferraro is Program Lead for Health Justice Policy Advocacy at Universal Healthcare Foundation of Connecticut. Rosana supports the Foundation's policy, advocacy, and grant-making priorities to achieve accessible, equitable, affordable, high-quality health care for all. She's worked in the nonprofit sector for more than 10 years, focusing on children, youth, and families, predominantly in the New Haven area, and she's originally from Puerto Rico. Rosana, thank you so much for joining us tonight.
Thank you so much for having me and for thinking of us to talk about this important subject.
So I lead community engagement at Connecticut Public, and part of our role beyond the journalism that Connecticut Public produces is to think about new partnerships in communities. And so when I met Shine through Connecticut Black and Brown Student Union, we talked about what is something that we can do in the community that would have real value, real purpose, and we came up with this series focused on serving the whole child. So I wanted Shine to begin by explaining the perspective of Connecticut Black and Brown Student Union on this particular topic, and why, when we think about social determinants, why we need to continue to have that conversation.
Yeah, such an interesting topic. So I've been doing this work for about a decade, and the conversation of education is something that a lot of people prioritize. We could say that in the room, right? Like, how many people think education is important, right? Thank you. So there seems to be a cycle of everyone here could be passionate about education, but the ways in which we see education and the different aspect and the different pieces to it is different for all of us, right? And for me, I just happened to be a part of that conversation through the lens of the student's perspective, right? And part of that is because I started doing this work as a student. And now as a staff at BBSU, a lot of the work that we do is targeting the issues that are impacting students when it comes to the conversation of safety. So this year we took on a different perspective of BBSU does statewide work, and as we were advocating for a policy of the conversation of safety, having police in school, but it's so much deeper than that, right? What about the systems of policing that exist without a present police officer being in those spaces? And that's when we come up with the conversation of the school-to-prison pipeline. There's so many different pieces to that pie that are constantly impacting students. But we cannot talk about the school-to-prison pipeline without talking about the conversation of healthcare, the conversation of housing, and how that impacts students on their day-to-day basis, right? So how do you expect a student who slept at a shelter or was dealing with parents having a mental health crisis or was spending the night at a hospital in the emergency room and couldn't afford healthcare to then come to school and be 100% focused as if when they walk through the door, they're supposed to leave everything behind, right? And it's not possible. We all here work. We show up to a job as our full selves. It doesn't matter the conversation. As adults, we do that. So why do we put that expectation on students? And it became really real for me this year as we're advocating for that conversation and for that piece of legislation statewide as a group, because we're like, it's not just about when they show up to school. How are we connecting with parents? How are we connecting with community members to know that all these pieces impact the whole child when they show up to the school? And that's a real conversation, and that's something we as a community need to start talking about. Because yes, some of us do healthcare work. Yes, some of us are advocating for housing. But we do all of that because at the end of the day, the person that's being impacted the most by it is our students and our kids.
And Shine did a beautiful job of summarizing this series. So tonight we're focusing on access to healthcare. In a couple of months, we're going to talk about access to good food, food security, and then later on in the spring, focused on safe housing, again, when we talk about serving the whole child. So thank you, Shine. What excited me especially about tonight is that we have two young people on our panel, and so often, adults, we talk about what's good for kids, but we don't include them in the conversation. Well, tonight, they're part of the conversation, so thank you for being here after a long day at school and all the other things going on in your lives. I'm wondering if we could if you could tell the audience a little bit about yourselves. Danielle, I wanted to start with you. Can you share a little bit about your family story? You told me you've only lived in Connecticut for about a year.
Yeah, so 1 year ago, we came with my mom. She's present right here. and, and my dad, with my little sister too. And we migrated from Ecuador about 1 year ago. Before all this, I didn't know even a thing about Connecticut or even healthcare. So coming here and to have that shock of finding out I cannot get access to healthcare or even hard on education and the cost was like a shock on me. And it was a heavy, like boulder. Yeah, boulder. Mm-hmm.
When you were asked to be on this panel, you know, it's hard sometimes to talk in front of people. And so what were some of the things that you wanted to share with our audience when we think about the importance of access to healthcare, Daniel?
I think everyone has a story. And when I had my friends or even involving for C4D, I have heard so many stories that had an impact in my life. And I think sharing our stories is the most important thing in this panel.
And you said C4D, so that's short for Connecticut Students for a Dream. Can you share some of the stories of your peers that stayed with you? People, you told me there was someone you knew who ended up becoming pregnant, and she did not have access to care. And so, how did you see that impact her?
Yeah, so of course. So I met Damaris in high school when coming in here, and she was 16 years old. She came from Honduras. And while on that travel from Honduras to the United States, she ended up pregnant. And when she got in and she gave birth to her kid, who's now 2 years old, she still needed to go to high school. Fortunately, she has her sister in here. But with all that, with having a children, going to high school, and also having to work to pay rent, her constant fight has made her even lose like the whole year of high school for her. She has been absent, and she had to repeat sophomore year again. So, yeah.
Janaai, tell us a little bit about yourself and why you felt it was important to sit on this panel and share your story.
Hi, guys. As you know, my name is Janaai, and a little bit about me is I'm going to tell you a little story about being an undocumented Black immigrant in New Britain High. So, junior year, I'm thinking about college, and like I said, I'm first generation, so I've never had anyone in my family graduate. I've never had anybody really tell me what to do, so that's scary. I went to my guidance counselor and I told him my situation, saying how I'm scared, that I have no resources. You know, no one really talks about being undocumented, and there are almost 3,000 students in my school, and I know that I am not the only one there who's feeling like this as well, but no one wants to speak up about that because they're scared. They get bullied a lot for being an immigrant. You know, people say, oh, ICE is gonna deport you, so I know that it's hard. He pointed me out to Connecticut Students for a Dream. And ever since then, I felt reassurance. You know, I felt comfortable, I felt safe. You know, I'm advocating for what I love, which is, you know, shouting out the unsung voices, being that voice, you know, actually finding the answers for some reason that's just not in New Britain. I just feel like there's no resources in New Britain. So my story is really like finding the answers and not being afraid to ask the questions that nobody else wants to ask, you know? So really, that's my piece.
I'm glad that you found that adult to help you connect with Connecticut Students for a Dream. What do you think would have happened if you didn't get that advice?
Personally, I feel like I still would have found a way. I'm known to just make a way when there's no way. But still, I know that it would have been harder. But definitely, I feel like I would have found something, but it just would have been harder. Connecticut Students for a Dream has definitely helped me. It's made me feel safe because I really didn't know what was going to happen for college.
Shine, when you hear Daniel and Janaai speaking, do you see a little bit of yourself in them back in the day?
Yeah, 100%. And, you know, it's something interesting about coming. How many people here speak a different language? Just a few. How many people here have family who weren't born in the US? Right? So there is something scary to experience when you're new to a country and when you're thinking about how to take care of yourself, right? Just the basic human right of having access to healthcare, that if your parents or your family is undocumented, there's a fear that comes with you wanting to go to the doctors, right? And while my family came here after a huge earthquake happened in Haiti, and we moved here in 2010, and we were in a different situations because my grandma was living here, so we did have like our papers and everything. But I'm surrounded by a community of people who are undocumented and who experience the fear every day of knowing that they are extremely ill, right? And they have a fear of going to the doctors. They have a fear of sharing their stories because unlike us, like young people, we find the groups, we find the outlets to connect with people. But a lot of adults, it's different, it's the opposite. If they found a group like C4D, they would be like, I'm scared, they're still going to report my story to ICE. Like, you know? So hearing Janaai and Daniel speak, I spent a lot of my high school year really connecting with community members and helping people fill out healthcare application for Husky and different things that I knew nothing about as a kid, as a high school student. But somehow we had to learn these things. We had to educate ourselves on them by force because we had people in our lives, in our family, that we care so deeply about that we wouldn't want them to be sitting with something that's impacting them and them not knowing how to treat it. And that's a common story in a lot of communities.
Janaai?
Yeah, so speaking about like the health insurance part, my family has a very long history of going to the hospital. My mother to this day still goes to the hospital back and forth, back and forth. And the only reason she's allowed to do that is because of my stepdad. You know, he's legal here. But the fact that my stepdad is the only reason my mom can go to the hospital is upsetting. I feel like we are all humans. We should be treated the same no matter where we came from. And I feel like the fact that we can't get the same resources that everyone else does here is very upsetting to me. My mother would have been dead if not for my stepdad being legal here. And I just feel like that's just insane. It's upsetting. COVID just happened. Like, people got COVID, and I know that if you're an immigrant, you didn't have access to health care. You died because, unfortunately, you weren't from here, so nobody cared about you. You know, you don't get a job because nobody cares about you because you're not from here. Doesn't matter your situation. It doesn't matter if you can control it or not, but because you weren't from here, I guess you're not treated like a human. We're aliens, and that's really upsetting. I just had to say that.
That's a lot to have to shoulder as a young person, worried about your mother, worried about friends who don't have access to care. And so have you seen that impact you when you have to go to school? How do you focus on what you need to do when you're worrying about your loved ones?
I'm always stressed. And I get a lot of the times as a teenager that I shouldn't have to carry all the things that I do. I have 8 people in my house. I have a lot of siblings. It's a very loud house. So when mom's gone in the hospital, guess who has to take some of the burden? I do. You know, sometimes I have to be the mother when I really don't want to because I go to 2 schools. I get home at 5:30 every day. I walk to school. I walk back home. It's very hard to cook and clean and do laundry and take care of my siblings and then do my work and then be an actress and then be a model. It's just a lot of things. So yes, it is very hard, but I have learned over the years to compartmentalize. Your mental health is very important. I've learned how to take space. I've learned how to take my time. I've learned how to really just trying to sort everything out, one step at a time, baby steps. But it is very hard, Being an immigrant is hard. It is really hard.
Daniel, did you want to add to that?
I totally agree with Janae. It's just so hard focusing on school when you got all these people around you that are worried about their life, their health, or even at home, my sister, my dad. It's worrying, and it's unfair that this is happening.
Because I feel like you just get no income as well. Like, what am I going to do? Like, I still don't know. Not being able to work. I mean, how am I going to support myself? I'm going to be 18 in a couple of months. It's hard.
Yeah, and you also have the way of you want to help. You want to really get involved and you want to help the people around you, but you can't because you don't have the resources or sometimes you can't speak the language.
I wanted to go to Rosana again, who's from Universal Healthcare Foundation of Connecticut. What resonates with you hearing from Janaai and Daniel?
I think what resonates for me is ultimately that healthcare is a human right, and we don't necessarily treat it that way in this country. I think for me, I think Daniel and Janaai have both spoken on how Connecticut Students for a Dream has changed their lives, but I would say it was around 2018, 2019, Connecticut Students for a Dream came to Universal and asked, what do you know about coverage for undocumented folks? What do you know about it? And we knew that at the time that California had started to cover folks through their Medicaid and CHIP programs, regardless of their immigration status. And so we shared that information, and that was the very beginning of the Husky for Immigrants campaign. Connecticut Students for a Dream had talked to their members, and their members said, healthcare is an issue that is important to us. Healthcare access is important to us. And I think one of the things that really resonates for me is this idea that young people don't live in a vacuum. They live within families, within their communities, within their schools, and they're impacted by all of the systems that we're all impacted by. And yet, oftentimes due to ageism, we're not asking young people, what do you want and what do you need? We don't do that very well in our healthcare system with adults, let alone young people. And I think that's a mistake. I think we fall short by not asking our young people, what are the solutions that you want to see? And what are the things that concern you the most? And I think I'll give a quick update of where Husky for Immigrants is right now, just to give some context. So the campaign has been able to win coverage for prenatal and postpartum coverage for up to a year for undocumented or birthing people, as well as children up to age 12. Once children turn 13, if they're still eligible, they can stay on the program till they turn 19. But if they're 16 years old right now, 17, 18, they are not eligible for healthcare coverage. And I think one of the other pieces to that is it also means their families aren't eligible for healthcare coverage. And to say that up to age 12 is enough, or up to age 15, which is where it's going to shift up to next July, is essentially, I think, sends a message that for our older young people that, well, we just can't get to it. There isn't enough money. And one of the main things that Husky for Immigrants says all the time is there is money. And there is a way to ensure that everyone in this state is covered in some way. We know after the pandemic that it's critical for everyone to have access to care and coverage. And I think the other thing about coverage that also impacts families is the economic problem. of medical debt when folks have to, by no fault of their own, go and accrue medical debt because they are not, without insurance coverage, they have no financial mechanism to help them. And I think that starts putting really hard choices in front of families about how are we going to keep the roof over our head and the medicine on the table and the food in the fridge.
It has a real ripple effect. When we talk about providing health care to anyone regardless of immigration status, you mentioned that policymakers see the cost as a potential challenge. But I believe 10 other states offer Medicaid coverage to those, even if they're regardless of their immigration status. Can you update us on that?
Yeah, so there, as far as young people goes, there's quite a few states that have covered all young people up to the age of 18 until they turn 19. And California's actually come a long way since Husky for Immigrants started, and actually starting January 1st of this next year, anyone of any age is eligible, regardless of their status, for coverage. The reality is that when you look at folks who are not covered, a large percentage of that population is folks who are denied access to coverage. Because not only are folks denied access to Medicaid and CHIP, they can't go on the state exchange, which is sort of a huge part of the Affordable Care Act, was having a state exchange that folks could get financial assistance. And somebody's immigration status would disqualify them. And then we talk about one of the great social programs in this country is Medicare. And a lot of times folks are like, well, when I get older, it's going to be great because I'll have Medicare. And, it's a lot more complicated than that, of course. But what about folks that are not actually eligible for Medicare either? What happens as they age? And so what happens to young people who are watching their family members age and require care, and what is the solution? And I think what Husky for Immigrants has done is build a broad coalition of folks that are directly impacted and community advocates and faith leaders and the medical community to stand up and say, from where we sit, this is an injustice.
Janaai, I believe you were working with Husky for Immigrants this past summer. Can you tell us about that?
I was actually working with Connecticut Students for a Dream. We were advocating for Husky Health for Immigrants. And it was a great experience. I spent my whole summer really going to different places like Hartford, New Britain, and I was canvassing, I was networking. It showed me social skills. It really gave me the raw truth of what life is, Some people had good reactions, bad reactions, but really, I wouldn't take it back for anything. I did what I loved, which is advocating for immigrant health insurance. And yeah, it was great.
Can you tell me a little bit about some of the bad that you heard? And Rosana, I'd like to hear from you too, because often there is this narrative, well, if we give care to everyone regardless of immigration status, what does that mean for people who are here legally? And so I'm wondering if you can talk about that and how you respond.
Okay, so there was definitely some bad. I know that people had questions of why should we give health insurance to undocumented immigrants. And I have to be as respectful as possible. So what I was saying was, we are people too. And I just feel like why would somewhere, I came from somewhere else, so why would that make me different from you? We both bleed the same. We both have, the same bodily function. So why are we different from each other? We are not different. The person walked away. But point is, that was the bad. And I know that that's real, though, right? Not everything is going to be a yes. There's going to be no's. And like I said before, it taught me a life lesson, and I really loved my experience. It taught me how to deal with rejection, taught me how to deal with certain things, and I would love to go canvassing again this summer, like really.
Rosana, when I hear Janaai share that, there's this belief by some who live in this country that it's almost as healthcare is a privilege, that it's something that is earned. How are we going to get past that mentality?
This is something actually that we talk about all the time in Husky for Immigrants because we often hear this. Well, I know folks that have documentation that can't even get the care they need. I was like, but that's not right either. So, sort of this idea that like giving healthcare coverage and access to undocumented folks doesn't mean that what we're saying is you don't deserve healthcare as well. What we're saying is that healthcare is a human right and that there shouldn't be any reason for anyone to not be able to access the care they need when they need it. And I think if we're gonna, come down to brass tacks about how much it costs a lot more to go to the ER when a problem has become severe and an emergency than it does to ensure that folks have preventive care. ERs are wildly expensive. Not to mention, like I said before, there's always the risk of medical debt, but then there's also the impact that poor health has on your ability to work, ability to provide for your family, and by prioritizing, by saying that for instance, we want to serve the whole child. Serving the whole child means inherently serving the whole family. A child with health insurance coverage with a parent that doesn't have it, there's studies out there that show that those children tend to not go to the doctor as often because their parents are not enrolled in coverage and aren't necessarily know how to navigate the system. And is the system difficult to navigate? Absolutely. But that doesn't mean that we should make it harder for some people to access care than others. It just means we need to change the system as a whole to ensure that everybody's getting what they need.
Daniel, I wanted to go back to you because you are in that age range, and I'm wondering, are you fearful of getting sick? Are you fearful of a relative getting sick? And how do you navigate that?
Well, yeah, I had fear of my dad one day. When we were back, he was really healthy. Back at Ecuador, he was really healthy. And coming here, he had problems with his hands. His hands started to hurt a lot, and that worried me because he's the main income of my home. What happens if he goes away? Like, what will that be for my mom or me, who are the oldest in the house?
We've heard from our other panelists about, some of the real consequences of, again, not extending quality health care to all. But something Janaai said earlier, which she talked about our mental health. And we've seen in recent years that people are more aware that mental health care is just as important as preventative health care. We've heard from the U.S. Surgeon General just a couple years ago that our young people in this country are facing a mental health crisis. And so when I hear Janaai and Daniel talk about access to quality health care, is the mental health care even part of that equation? That they can even think about, well, what happens if I'm feeling depressed or one of my classmates feeling depressed? Where do they go for help?
Oh, okay. Anybody with kids in the house? Okay. I'm not a mother, but I have I have a huge family. So literally a lot of cousins and siblings. So I think this brings us to the conversation, like, a lot of us reach a point, even in adults, right, where the conversation, where especially after COVID, realizing even therapists were running out of spots to like take people in, right? And then now we have this conversation of what does that look like in our young people? We hear often, young people are the future of tomorrow. What does that future looks like when we're not investing in our young people, especially when it comes to their mental health? Who are we going to have as the CEO, the directors, the journalists, the doctors, the attorneys? How do we expect those people to interact with our community when they're mentally not well? That's a serious question. And our country, our world, is doing our community a disservice to not see that as important. I don't want to go to the hospital and a doctor who dealt with a lot of childhood trauma that they could have dealt with at the time didn't. And now my family's being mistreated. I don't want to work under a boss or with somebody who is not an adult and still act as if they would when they're 12 because they dealt with a mental issue that was not treated. That's the reality we're headed to if we don't take these conversations seriously. We'll get to a place where we're frustrated with adults, but those adults we're frustrated with, we're like, you're like in your 40s, 50s, and you're still acting like this. No, they were 12 like this. They just aged, and we expect them to now act different. They just got older. Nothing's changed. And we have to shift that narrative. The mental health of our young people is important. And it's an issue that we need to look at today, not tomorrow, not the next day. It is critical now. Because a lot of us as adults are dealing with things that is incapable to move through our days because of things that mental health wasn't the priority of conversations at some point in our society. And now these things are coming up. We're seeing people who are dealing with these issues, and those are things that could have been different now if we took mental health seriously. And part of that reminds me of some of the things Janaai said too, of like, legislation will get passed, and people, excuse my language, will stay ignorant. You know why? Because legislation doesn't change people's heart. That's why organizing is important. You pass a policy, it doesn't matter what it says. A lot of people are unaware of it. At the end of the day, if I'm anti-immigrant, I will remain anti-immigrant no matter what the law says. Because the work is up to us, of what we do to educate and inform the people around us about why these conversations are important. Why is the mental health of our student important despite what a policy, a piece of legislation says? Because at the end of the day, it's just a piece of paper. Your heart, my heart, remains as it is unless we do something about it.
Rosana, you're our policy expert, so during the pandemic, we heard a lot about the importance of allocating resources towards counselors in schools and not SROs, as Shine had mentioned earlier on in our conversation. So is Connecticut doing better? Are we seeing those necessary supports and resources in schools?
I think realistically, I heard someone say this, and it really resonated with me. Somebody was like, you know, we can't staff up to fix our mental health crisis. That doesn't mean that we don't need more therapists, that we don't need more folks in schools that have a reasonable caseload, because we often hear about school social workers having hundreds of students to care for and to worry about. But I also think that we need to look at social determinants. What is it about the structure of our society What is it about our economic system? What is it about the way we still in this country have ideas about who deserves help and who doesn't deserve help? Those things all trickle down. And I think I used to work with young people in middle school here in New Haven, out in the Hill. And one thing I will say is that, and that I miss about not doing that every day anymore, is that there's a real honesty with young people. And they were very frank all the time. And I was always struck by the idea that adults often want young people to do things their way, but there is so much change and innovation and restructuring of the world that we need and revisioning of the world that we need, and it's clearly that young people have that energy. And I think that one of the challenges around mental health is that, yes, we need, and not only do we need more therapists, but we need more therapists of color. We need more people who are directly impacted helping each other. There's a sense of there's a little bit of a mutual aid element here, right? Like, we need to be helping each other. And we need to be able to lift each other up. And it almost becomes that we can't just leave mental health to the social workers and the therapists and the psychiatrists and some of the systems that are in place that are not unlike our prison systems, and really take responsibility, like Shine was saying, that we all need to take responsibility for the mental health of our communities, and that definitely includes our young people. So I just really think about, how do we create not only a mental health system, a healthcare system that works for young people and for everyone's mental health, but how do we create a society that works for everyone? And I think that's at the root of organizing and at the root of fighting injustice.
So we have people in the room from different parts of our state. So Daniel, Janaai, Shine, what can each person in this room do to help get towards this goal of serving the whole child, the whole family? Shine, or Daniel, do you want to start?
I think it's great if we can share. Share whatever you can, whatever information that is around, or on the social media page, on the newspaper, on an ad you see, take a picture or share the post. It's important that everyone needs to inform themselves, so they share with others. And with that, we can create a better community.
Thank you. Janaai?
Really, it's more about action. Like, I want to do it now. I want you to be persistent, right? I want you to take that risk and embrace that failure and celebrate difference. I really want you to, like, take a look inside of yourself and really, like, think, like, you know, about your society, about your environment, and really, like, take that into consideration. Like, how can I make a positive influence? For example, one of the ways that I'm doing this is by my fashion workshop. Like I said before, if like mental health is very important, that's what my workshop is really all about, self-care. I believe that if you look good, you feel good. A little bit about me is, back in 6th grade, I used to get bullied a lot for being tall, for being black, for having acne, for not having the big brands, all of that. If I could just help somebody else feel safe and feel confident in themselves through fashion, then that would mean the world to me, if I can just be your outlet. So yeah, I'm all for helping the community through, and by my ways, through fashion. I feel like it's very creative. I feel like it's just what you put on, how you present yourself is really like representation of what you think about yourself, I feel like. So that's my way of taking action and really spreading that positive influence in my community. And I hope that you guys will do the same. I know that we have different ways of doing it, but yeah, that's my way.
Thank you, Janaai. Shine?
I'm an organizer, y'all. So you'll hear from me again. And what I mean by that is I believe we're at a critical point in Connecticut where even after 2020, right? And 2020, it was the time where it was trending and it was cool, but it's still important. Whether it's not trending anymore, all of these conversations are still important. So for me, as an organizer, I'm about building the numbers and seeing what that looks like, that when we continue to run our campaign, and I need someone to show up and testify, that I know y'all have my back, right? And I know that if I need an email sent out, whether you are an artist, no matter what you do, and you don't consider yourself an organizer, whatever your title is, it's still important. It's important in this work. So I have a goal of what I would like to see our state looks like in the next 5 years. And part of that is mobilizing 1% of our population of people who choose to stand up when we need action taken. And action looks different for every single one of you in the room tonight. So my ask to you all is to please join that 1%. Because we can come here and have all these conversations, but then what happens next? And this is a first great step, and I would love for you all to stay and continue to be a part of these conversations and to be a part of the next. Because it's bigger than us. There are the importance of what happened here tonight is there are real people behind those stories. Those are real experiences. And our students, our parents, our community members are experiencing those every single day. Some as we speak right now. So I will need you all to stay with me. Stay a part of this conversation. Stay a part of this movement. Because Connecticut can be different. It doesn't have to be like all the other places. Because we are different. And I need every single one of you with me to do that.
That's a good transition to opening it up to audience questions. Francesca from Connecticut Public has the microphone, so if you'd like to ask a question of our panelists or share an observation, we'd love to hear from you in the last few minutes. We have one in the front.
Hello, thank you all. And thank you for taking the time, and I really appreciate it.
I'm sorry, could you do it in the microphone? Thank you.
I appreciate you holding this forum and all the information given. We're in the New Hallville neighborhood of New Haven. I grew up here. A lot of the population are historically like Black American. They are naturalized, came up from the 50s where grandparents came up from the South and worked at Winchester Gun Factory, and a lot of Black Americans settled in this area. A lot of people who are not immigrants have access to health care, Medicaid. Black males, Black women who are younger are still going through that prison, school to prison pipeline, and they have Medicaid, but they're still not able to access that mental health component, which oftentimes leads to like behavioral issues in school, which if undealt with eventually leads to like criminalization, because now it's not seen as a healthcare issue and kids are acting out and they're engaging in criminal activity. And these are people who may have Medicaid. What if anything is being done to kind of close that gap. And does your organization speak to that at all?
Thank you. Rosana, would you like to go first and then Shine?
Yeah, I'll jump right in. And I'll say that change takes this is like my least favorite thing in the world to say, but change takes time. But also, just because a policy gets passed doesn't mean you get to, you just sort of like, it's not the set it and forget it gadget, right? There's still need for advocacy to improve access to mental health care services for young people that have access to Husky. Why are there so few providers? Why aren't there enough? How do we solve that problem, right? Because I think healthcare coverage is only the first step. We need a solid healthcare system for folks to access with that coverage. So ultimately, we'll go back to, as Shine was saying, it's about organizing community and saying this is unacceptable. This is our state/federal healthcare system, and this coverage isn't doing enough, and it needs to do more. And we need to make demands of the people that are in charge. Husky for Immigrants has gotten some wins, right? We continue to talk to the Department of Social Services as that gets implemented and rolled out. We share where there's challenges. There probably needs to be more of that, not just with the new coverage that's been expanded, but the coverage that already exists. Because in a lot of ways, if we can't get it right for folks that are most directly impacted by injustice, we're not doing it right. We're not doing it right. We can say that like Connecticut's one of the healthiest states, but when you really break it down, there are real disparities. Just like we have economic inequality, it's the same thing. Some people are getting the really good care, and some of us are not. And that is because ultimately we need to change the narrative around healthcare truly being a human right versus being a privilege or some way to make some money. So.
Shine, did you want to add to that?
Yeah, that's a really good question. And the reason for that is people always see those two as separate, but it's not. It's not separate. The first part of your question, students and individuals in our community usually, even if they have access to health insurance, do not use it for that mental health aspect of it because of a stigma that is within their community, that is within their homes, that is within circles they're a part of. How dare you go and speak to someone else about issues happening in this household?
Right. That part.
How dare you? These are family issues. Do we know what fear that creates in a child? Even for us here as adults, we did that. We put those in place. And it needs to stop. I heard there's a lot of parents in this room. People raise their hands. It needs to stop. If you're one of the parents doing it to your child, it needs to stop. Because now you're creating children who has to heal from your parenting. And that's not fair. And those same people works with young people, they work in the schools, they're superintendents, they're teachers, it shows up everywhere. The school to prison pipeline exists not because students are bad. It's because adults created it for kids. It's all our fault. We did it. We, the adults, did it. because we ignored the root of it, and now it's too late. Because now they're here. Now they're there, being pushed and funneled into that system. And it's not fair. So then it creates that gap. Criminalization. Now they're criminals. Who is responsible? We were meant to walk alongside them. If that fails, we failed. But we don't blame ourselves for that. We point the fingers because that's easier to put it on a child. And we as a community need to do better.
Is there another question from the audience for our panelists? We just have a couple of minutes.
Hello, I want to thank you for sharing. And I agree that it's very important to tell the story. I think that we have to realize that the implications of systemic and institutional racism. It has been in this country for a long time, and for those of us who arrived in 1619, we often feel as if we are always the last to be considered. Based on what you said here this evening, it exemplifies the need for all of us to come together, to tell our story. We're all human beings, and you're right. We deserve health, we deserve housing, we deserve equity in getting banking. We need to hold nonprofits accountable. Remember, we didn't get here by happenstance. Poverty is a money-making industry. Okay, don't forget your transportation system, where that money comes from, who holds that. It's so refreshing to hear you young people tonight to talk, but we need to forge a powerful bond. We're getting ready to go into 2024. If you can spend $150 billion to declare war, you surely should be able to have universal health care in this country, as well as universal education.
I feel like that needs to be the last word. Any other questions before we wrap up this evening? Well, one more.
Thank you all for being here, for sharing your stories. Question to close us out. You've talked about the struggles you've had individually, your families, as young people. Where do you get your motivation, your fuel to feed this commitment? There's so many sub-questions I could go into, but I'm just curious, like, where's your hope? How does that feed you to inspire? Because you've been so inspirational to all of us here tonight. Would love just a hint, a little light of what fuels you in doing this work. Thanks.
I'm looking at you, Daniel.
Yeah, well, for me, it's the results. Last summer, we did the program in New Haven, the same program that Janaai did in the summer. And when we shared that there's possibility for those that are hopeless, their faces bright. Their faces bright, they smile. And that expresses hope.
Thank you. Janaai?
Honestly, being a black woman in America is already hard enough. I just keep on going because I feel like I'm looking at the future. In my family, like I said, nobody has ever graduated college. Nobody has ever done things. Like, I just feel like in my family there's a lot of disappointment, there's a lot of negative energy. I want to show them that there's more than that. Like, I want to show them that there's a path, and we don't have to keep on having like this generational curse where there's just failure and failure and failure. I want to show them that there is a way. I want to make that way. I want to make my own path. And like you said, giving people hope, finding results. I know that when I did Connecticut Students for a Dream, I found hope. I found like my savior in being undocumented. It was just great. So if I could just tell other people that there is hope, that there's a light, that there is an outlet for them, that's literally like one of my biggest motivations. Like, you just need to keep on going because it just never stops, A saying that somebody told me the other day is, sharks swim. They take breaks, but they never stop swimming. And what basically that means is I could take a break, but I'll never, ever, ever stop swimming. I'll always keep on going. I'll always keep on fighting for what I love. Because once you stop, then you die, right? You die. You get no food. You can't survive. And I feel like once I stop, that means they've won, not me. Thank you.
Well, we're at the end of our hour, and I feel like we could keep talking, but I wanted to again thank our amazing panelists, Janaai John, Daniel Palma, Fareus, and Rosana Ferraro. I'm Lucy Nalpathanchil. Thank you so much for coming tonight.